Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stauffer. Well, the Center for Disease Control just came out with some information about the use of fentanyl, and some of the numbers, I would say, were shocking to some, and yet maybe not shocking to our community. Joining us to talk a little bit more about this is Dr. Chris Eberlein from Emergency Medicine at Gunderson Health System. Thanks for being here.
You're welcome. Thanks for having me.
Let's talk, first of all, what the CDC, the Center for Disease Control report, was all about. Can you give us a little background on what that report was about?
So it was a report basically accumulating the data from 2016 on deaths and the trends they're seeing on the deaths in 2016. And the drugs that are they basically ranked them in order of which ones are causing the overdose deaths. And so the number one was fentanyl, and number two was heroin. And then it was kind of a scattering of other opiates and cocaine and methamphetamines. But those are really the two big ones. And the concerning thing is the fentanyl numbers have really shot up compared to the other numbers. And that's really kind of what they were focusing on, was these synthetic opioids.
Now, I think that a lot of people would say, I'm shocked that the numbers are going up, but other people like yourself who are in the trenches in many manners of speaking, you're not surprised. You're seeing this right in our community. It's not a problem just for big communities. It's a problem for small communities right here in good old western Wisconsin, southeast Minnesota, northeastern Iowa.
For sure. The numbers and the statistics that they were showing on the national scale really mirror what we've been seeing locally over the last several years.
What's the demographic? Who is the typical, I'll say, overdose patient?
Well, that's where the interesting part of that stigma comes in, is that there really doesn't seem to be a typical patient. We're seeing patients from, late teens, early teens, all the way up into the 60s, 70s. There's a bell curve. It seems to peak in the 30s and 40s, but we are seeing this come from all ages, all socioeconomic status. So it's really affecting our entire community.
It's men, it's women, it's teenagers, it's seniors in some ways.
For sure.
And it's very difficult, from what I'm learning anyway, it's very difficult to recognize that, maybe somebody is addicted on an opioid. Sometimes, I know you told the story recently of a mom brought her son in and had no idea that opioids had been something that he'd been using for a while.
Mm-hmm. Yeah, it happens frequently where someone will come in and you start having that conversation, and then it comes out that they've been abusing this drug for months, if not longer, and the family had no idea.
Let's talk a little bit more about the numbers, because I think the number that stands out the most, maybe to you, certainly to me, is 29 deaths in La Crosse County.
Mm-hmm.
Talk about that.
Yeah, it's been steadily. We had a little bit of a reprieve when this first came out and the heroin task force started. We actually had, I think it was 2014, where we were the only county that had 0 deaths. And that was after we did the big Narcan push out for all first responders and law enforcement. But then it's been slowly creeping up. And like mentioned in the CDC report, we are seeing this concerning trend of increasing synthetic opioids. And I say synthetic opioids, I group them all together, and fentanyl is the one that most people hear about. We've all heard of the elephant tranquilizer, carfentanil too. That still has been out there. We have not, at this point, seen a death in La Crosse County from that. If there was a brief time we thought we had one, but it's been in the area, but it has not been in La Crosse County.
So for those of you listening or watching, Dr. Eberlein just mentioned the elephant tranquilizer. That's what this is. Mm-hmm. And it's just sort of thinned out. That's what's happening. You're not misspeaking.
No.
That's what this...
That is what this drug is. In fact, what they tend to do is they take these very powerful synthetic opioids, fentanyl, and is one of them, and carfentanil is the other. And there's actually about 20 of them that are out on, in the market, so to speak. But they take those and they cut it with heroin, and the addicts never know really what they're getting. And so when they're used to injecting heroin, and you inject any of these other drugs that are a multitude stronger and it's the same quantity you're injecting, it causes respiratory depression and death, unfortunately.
And these labs are happening where?
We believe most are come from overseas or across the borders. They're big chemical labs that are set up and they produce these. And because these drugs are so concentrated, a small amount, you're talking if a drug is 1,000 times more potent than heroin, we need 1,000 times less of it to smuggle in. And so that's why we're seeing these drugs, because it's easier for them to get them into our country and into the communities. And then they depend on your local drug dealer to mix this stuff or cut it up into smaller quantities. Well, you can imagine how that probably doesn't go so well.
Yeah, and then you're also asking for first responders, police, fire, EMS workers to come into some of these situations, if you will, where carfentanil is being cut, potentially life-threatening to them as well.
For sure, and that's why we've done a lot of training on EMS and police to know the signs and symptoms of overdoses, to be able to administer Narcan and rescue breathing and things like that. But a lot of it's just being aware of the scene, using personal protective equipment, and just having knowledge of this so don't get yourself into a situation.
A lot of training happens in our community on that topic, that's for sure. Luckily, there is you mentioned Narcan. Talk about the importance of Narcan and how it's saving lives and how it's available in the community as well.
So Narcan fortunately we have Narcan because it's a pure opiate antagonist. So it knocks the opiate off the receptors in the brain so you can start to breathe again and function again. And so that's how it works. And it comes in several forms. The one that is most highly available is a nasal form. So it's actually a nasal injection. It atomizes and basically a mist up into your nose. And then that is very close to the brain. And there's a cribriform plate right up in your nose where all your olfactory cells are, and it absorbs through there and fairly quickly into the brain within 30 to 60 seconds. You'll start having an effect. The other forms are intramuscular, takes a little longer. You need a needle. You have to inject someone. Auto-injectors are very expensive. And then the last form is the IV form that we tend to give via paramedics in the field or at the hospital. You can get Narcan. I recommend patients talk to their doctors about it. If you are being prescribed an opiate, we're really trying to remind patients and physicians to consider prescribing Narcan with it because you don't know who's going to come in contact. If there's an inadvertent overdose, we're really trying to promote that. And we've worked hard with our local insurance companies to get that covered with either fully covered or with a small copay.
Okay, who is purchasing Narcan? Because I'm thinking that for the most part, it's not necessarily someone who is knowingly or unknowingly addicted to an opioid.
Yeah, we've Narcan is available over the counter, and the sales have not been what I had hoped, but it is what I expected. The cost for Narcan over the counter is about $80 a dose. And when you're talking to the addicts, that is several doses of their opiate of choice on the street. So they're not going to be buying that over the counter. The people that we see buying over the counter anecdotally that I've been talking to are people that they have a loved one they're concerned about, son, daughter, friend, brother, sister. These are the people that tend to be buying it over the counter and having it in their house.
All right. Right here in the studio, we actually have a box of the of Narcan. It's really pretty. It looks very easy to use. Something that you recommend to have in case you are concerned with a family member?
For sure. I mean, if you have opiates in any significant amount in your house or you're concerned about a loved one having it, this drug really is a lifesaver. And it reverses the drug and the opiate they took and gets them breathing again. When you've seen someone wake up from an opiate overdose with this drug, it is nothing short of a miracle once you've witnessed it.
Well, and you said for $80, it might be just that miracle waiting in your home or in your vehicle or wherever you need to have it.
Absolutely.
Yeah. We're talking with Dr. Crosse, Emergency Services at Gunderson Health System, about opioids in our community. We're going to be back in just a moment, and we're going to talk to him about where we're headed in the future with opioids. How can we tackle this problem, and what some of the statistics look like down the road. That's next on It's Personal. It's Personal is brought to you by Gunderson Health System. Welcome back to It's Personal, brought to you by Gunderson Health System. I'm Chris Stoffer. We're talking with Dr. Crosse Eberlein from Gunderson Health System Emergency Services about opioids. And I really want to talk to him a little bit about the future. What's being done in the community? I know you're involved not only in the emergency room at Gunderson Health System, but you're involved with what's happening with Gunderson Tri-State Ambulance and other efforts that are underway in the community. But I want to first ask, is enough being done?
Well, as long as people are still dying and addicted, we haven't done enough, but we are making big strides as a community and as an organization at Gunderson to make a big impact on this problem that's affecting our community.
Yeah, and all we can do is try, right? And I want to ask you about some of the other efforts that are underway right in our own backyard to tackle this problem. One of them is relatively new.
Mm-hmm. Sure. Well, we had the heroin task force that had been present, and we were going on year 6 of it. And then there was a grant from the Institutes of Health that provided money locally for basically the pilot program to start a new group. And we took advantage of that grant, and we currently have now called ourselves the Alliance to Heal. And what that really did is take some of the energy that we had and give it a little more form. And so we've really seen a new organization come out of this with a lot of energy and a lot more people involved. And so I think this organization will really move forward our efforts on this problem.
Try and move the bubble. Talk a little bit about who's involved and what maybe the goals are here. Obviously to eliminate opioid use, but
sure.
Talk about that if you would.
Yeah, so I like to break it down into subgroups because that's what we've done in the group itself. So the things that we've been working on, for instance, we are working on limiting the use of opioids, and that is prescriber-based primarily, where we're working with both hospital systems have representatives on this group, and we're really looking at how to implement the best practice for prescribing of these opioids, because we know that 80% of our addicts started with prescription opioids. So right there, we could eliminate 80% of this problem down the road if we can control the input of opioids in our community. The next one is diversion of opioids. So really looking at the drug take-back boxes, working with the police, working with prescribers to flag patients that have diverted opioids, things like that, working the prescription drug monitoring program. And then working with alternative pain management, because getting back to, we want to take care of these patients. We don't want to leave them alone in this time. And that's a real concern that a lot of patients have. So I want all the patients that are struggling with opioid addiction to know that we do care about them still, and we're trying to get them off these drugs but still treat their pain. So
trying to have a place for them to go, a resource
absolutely,
for them.
Yes. We don't want to make them feel that they are abandoned at any point in this process, because we really want to work with them and get them through this, because it is an addiction, and they have to work with their doctor and their health system to get over this.
And as you said many times, not an addiction that was brought on by themselves. It might be because of a prescription that they became addicted to, unfortunately, over time.
Absolutely. And so we want to make sure these patients are taken care of. And chronic pain is a real problem. It's been a problem since I started my training to treat. We still don't understand it that well, but now we understand that opioids aren't always the answer, and sometimes they actually make it worse. So what we want to do is make sure that the patients that need opioids get them, but those that have better alternatives, we can get them into those.
And I've heard you say there's other ways of addiction. It's an individual has some anxiety, tries mom's Valium or tries dad's Valium, and next thing you know, they're like, wow, this really worked for me, and not understanding that it's an addictive opioid.
Absolutely, yes. And to realize that there are better treatments for that anxiety than that
And
drug that they're using.
that self-medication out of the medicine cabinet is
Yes.
not the right way to go. Other subgroups that are
Some of the other subgroups are adolescent and community education, because a lot of this gets back to community education on the importance. And I've seen a big impact in our community. People used to come in and they kind of expect narcotics. They associate narcotics with pain control. That is not the case anymore. People are coming in, and now if they've got, some ailment that's causing pain, they'll actually have that. They'll actually initiate the conversation of, do I really need opiates for this? Is there other things that I can do? Which is really enlightening to me that a lot of this education is coming across.
and sometimes it's not just one thing. Maybe it's multiple things that can help alleviate pain.
For sure, whether it be injections, chiropractic, massage. I mean, there are so many other modalities that we can do to help people with their pain. Physical therapy is a big one. We just have to. The problem with a lot of those, they take more time.
Yes.
And we have to have that time with the patient and have that conversation. And it's not as quick as writing a prescription. And so we're getting back to that, taking care of the whole patient, and that's really what's important.
And we're in a society that you want things quickly, whether it's your fast food or whatever. We're in a society where instant help is a lot of times what people are looking for.
Absolutely.
So it's an education process, as you said. So
Yes,
that's
it is.
one of the subgroups of this newly formed group. How long has the group been in?
Well, we started kind of forming it last year, but it really kicked off this last summer.
What other subgroups are you looking for? What other individuals are you looking to be part of this?
Sure. Some of the other, there's a couple more subgroups. Uniform assessment and navigation, and that one's getting patients when they come in with an addiction, having a uniform assessment and figuring out what works and what doesn't, and getting these patients aligned with the proper treatment. And, and that's been a big gap in our community that was noticed. And then one of the other big gaps, and some of these are obviously not quick fixes, and this one in particular is improving a residential or getting a residential inpatient detox and treatment center, and we don't really have that here. So that is a big one. That you're talking capital. So that is one that the community will have to work hard at getting. But there's a good group of people working on that, and then some of the other ones is improving access to medication-assisted treatment, because there are medications that can help with opiate addiction, but in the past it's been hard to get in sometimes, and so now we're working at expanding providers that are willing to do this, and the resources around the provider. And that's one thing that when you talk to providers that prescribe these medication-assisted treatments, is that it is the social services, the nurses, all that around them that take the extra time, because these patients, they have a lot of questions, they need a lot of extra support, and that is that peripheral group around the provider that is so important in treating these patients. And it really has to be a system approach. And then the supporting services after someone recovers. We hear it time and time again, you recover and you get back to that same situation you were in first. It's just a recipe for failure. And so to get that post-recovery phase taken care of is a big deal. And that's another one that's difficult to do, and it takes the whole community's involvement to succeed. And then getting down to, obviously one of my pet projects is increasing Narcan availability. We've done the over-the-counter. We've gotten out to police and fire. The big thing on the horizon that I see that we've talked about before is cost. So I've seen Narcan probably go up in cost tenfold in the last 5 to 10 years.
Who knows where it's going to go over the next 3, 4, or 5 years.
Exactly. So I'm looking at, with our group, alternatives, and one of which is, I like to say, Narcan is really liquid rescue breathing in the field. And so if we can get pocket masks out in the community, and we can, and I'm working with the AIDS Resource Center, a healthcare coalition, to purchase thousands of these masks. They're very inexpensive, a couple dollars a piece, much cheaper than Narcan at $80 a dose. And if we can get these to be distributed with the needles, with the Narcan, perhaps we can make an improvement, and especially if Narcan becomes prohibitively expensive.
So this is an alternative. Pocket masks, how do they work?
So basically rescue breathing. So you have the pocket mask, it's a one-way valve, it's a shield. You can give some rescue breaths while EMS is en route if you don't have Narcan available. Because an opiate overdose is a respiratory arrest. You're no longer breathing or not breathing enough. If we can give those rescue breaths in a safe manner, like a pocket mask or a bag valve mask like we use in the ER, a couple of breaths will get them by for a while. And so if we can do that and train people in that, if Narcan becomes unavailable, it gets very expensive, we have that alternative. So, and as these opiates have gotten so much stronger, the first dose of Narcan doesn't always work. Mm-hmm. So if we can, it's all about getting that patient treated and in the most beneficial way and cost-effective what's available.
Dr. Eberlein, we're out of time, but we really appreciate you coming in. We're hoping that you come back, and we certainly wish you the best of luck. I do want to ask you again, how do people get involved?
Yeah, so the Alliance to Heal, this website off the county and website that you can look at. So the meetings are open meetings. If you're something you're interested in, you can contact some of the people at the county health department, right, and they can show you the way. Community
involvement is going to be key. As you said, there's everything from creating a fundraising, some capital that is going to be necessary, to getting the word out about Narcan. Mm-hmm. And I think motivating our community to get involved is a good route to go. Dr. Eberlein, thanks for your involvement with this. And happy holidays, by the way.
Thank you, and you too.
Tough topic, that's for sure, to talk about around the holidays, but a very important one, as noted, 29 deaths in La Crosse County alone. We are going to be back in just a moment here on It's Personal, which again is brought to you by Gunderson Health System. When we come back, a much lighter holiday topic. We're going to talk about the 5-second rule. We're going to talk with infection control about how do you feel about dropping something on the ground. That's all next on It's Personal, brought to you by Gunderson Health System.